I've been fortunate in having a good opportunity with the type of patients I see to really gauge the success in prescribing Regener-Eyes. I have a pretty advanced ocular surface disease clinic. I head up cornea services at Kentucky Eye Institute. We have over 500 positive diagnosed Sjogren's syndrome patients as an example. A lot of graft versus host, but really a lot of dry eye patients, which you would have in your clinic as well. And, I think the ability to prescribe something in the biologics category has become required. You really can't function well in managing these patients without that. And many of us also agree that doing something more natural, such as a biologic, often is preferred over therapeutics or medications. We certainly see this much more in the systemic realm, but I also see this even in the topical realm. When I talk to patients, say I've got a couple options because you have significant damage to the surface of your eye. Of course, in our world, that's staining and PEK. But I tell them we can either do it more naturally or we can do it with some therapeutics. And patients almost always choose the more natural biologic option. So Regener-Eyes comes in two forms, which has also been extremely helpful. The full concentration form, which you refrigerate, and then Regener-Eyes Light, which is a little more practical. And for some of my patients, having that in a bottle, leave on a shelf, good long shelf life, has been extremely helpful. I love the fact that they can use it for a period of time. In fact, I tell patients even if I'm using other products like amniotic membrane, I might start with that, and then I tell them this is the amniotic membrane in a bottle. So they kind of understand how the two work together and how helpful that is. And then there are many times where the light comes into play where I have enough ocular surface issues, but I'm not able to maintain corticosteroids, or I want to go the more natural biologic route. And I go to that right away for those patients and have had dramatic improvement in healing that ocular surface. The growth factors that are present in cytokine extract drops and biologics of this nature are going to do more to the ocular surface than any artificial tear can do. Artificial tears are essentially that. They're artificial, they're lubricants. They have a role, but not really a healing role, not really a therapeutic role. So having a biologic option like Regener-Eyes comes into play significantly for these patients. My main category of use is, of course, dry eye disease. I think it's a very natural way to do it. I wouldn't prescribe it if there wasn't some corneal findings, but as you all know, the majority of our patients who present with significant symptoms have punctate epithelial keratitis or superficial punctate keratitis. So in those cases, it's an ideal scenario. I still may maintain long-term drops because it is a long-term chronic condition, but if they have a flare-up or if they have initial presentation or I want to control PEK, that's a wonderful route. Other applications might be neurotrophic keratitis, might include just any sort of ocular surface damage, exposure, keratitis, another group of patients that respond wonderfully to these drops. And you just gauge the severity. If you feel like it's an extremely severe issue, like say, for example, a persistent epithelial defect in a neurotrophic keratitis, I would definitely use the full strength concentration Regener-Eyes. If it was a PEK or SPK in a dry eye patient that I just didn't want to go steroid route, or wanted something more natural, or I wasn't able to control it, then I would naturally go to the light and then gauge that based on where we work. And I think the light gives us the opportunity to introduce this technology sooner in the patient's disease profile, and with that, greater outcomes by preventing the disease progression. So a lot of applications, but a wonderful need. Anywhere in the biologic space, we're going to have continued need for our patients because they're learning more about it. They're understanding how important it is. It's on the internet, but more importantly, the results are there. They're quite impressive. It's an incredible ability to reheal and regenerate the surface, and Regener-Eyes is kind of the perfect name for this drop.